Yes, sir, I can see it clearly.
All right, so it's once again, it's great to be a part of this meeting. I'm going to just start out by saying that telemedicine itself is, a subset of what we call digital health, what used to be called eHealth broadly. And we'll be talking about some of the policy that exists in the country with regards to telemedicine and digital health at large. I'm going to take us on a journey of history, how far we have come, and then the evolution of the policy. And then I will talk a little bit about the digital health strategy document that eventually led to the policy that we have today. I will also talk about the national digital health policy that exists currently. I'm sure you know that there's just so much I can say about all of these things in 20 minutes. So I'll try to summarize some of them and be as brief as I can be. But there will be opportunities, I'm sure, in future to talk more extensively about them. So I'll start off by saying that back in 2006, June 2006, the Society for Telemedicine and eHealth in Nigeria organized the first Pan-African conference on telemedicine and eHealth. It was basically bringing the federal government together to a discussion table. The meeting was sponsored by NEPAD, the New Partnership for Africa's Development, NHIS, NCC, and some other people. And the key thing was that at that meeting, the society pointed out the need to chart a course for digital health, both strategically speaking and in terms of policy for the country. So I've quoted out one statement that came out of the communique of that meeting, and it is that government should formulate policies that will create the enabling business environment and provide incentives so as to encourage the existing telemedicine programs and development of new ones, particularly in the private sector. So that came out of that meeting, and that was in 2006. Many years later, we are where we are now. And when it comes to policy, we know that ultimately every government document takes its root from the Constitution. But a lot of things happen in the course of that also help shape what we ultimately have as a policy document today. Along the line, we had the Nigerian Vision 2020, which was designed to place Nigeria in the league of the top 20 countries in the world. And of course, they say health is wealth. So as you consider being one of the top 20 economies, you also have to plan for the health of the populace. So that brought out a lot of issues about the health of Nigerians. And then again came along the National Strategic Health Development Plan that ran between 2010 and 2015. It basically ran on the Millennium Development Goals, to accomplish them. But somewhere along the line, we also had the National Health Act, and then eventually we had the Sustainable Development Goal, and then we got a National Health ICT Strategy Framework, which was for the first time Nigeria developed a strategic approach to bridging the gap between healthcare objectives of the country using ICT. So sometime in 2019, an NTAM review of that, staff framework was done, and then we had the development of another strategic document, another strategic health development plan that was designed to take course to 2022. And then a lot of other documents came in along the line, and ultimately it led to the development of the National Digital Health Strategy. And that document is designed to span between 2021 to 2025. Basically, this document is just laying down the approach that government chooses to use digital health as a tool to meet and to close the gap between the health objectives and the current position where we are now. So this document actually led to the policy document that was eventually developed. The ideas that government, the direction that government wants to go, led to the kind of policy that was developed for digital health. So basically, this document, the National Health Strategy document 2021 to 2025, has a vision. And the vision is that by 2025, digital health will accelerate the progress towards achieving universal health coverage in Nigeria. It's to strengthen the National Strategic Health Development Plan and then ensure healthy lives and promote the well-being of Nigeria using digital health interventions. So the strategy was to strengthen primary health care, the referral systems, emergency medical care services, and to remove financial barriers to access of health care. So when we talk about strategy, when we talk about privacy, we also have to talk about the digital health environment in Nigeria. And talking about this, there are two components that we have to look at. One of them is the ICT environment. And this is on the spectrum. At one end of the spectrum, you have what we call the emerging ICT environment. At the extreme end of the spectrum, you also have what we call the established ICT environment. Then on another plane, you have what we call the enabling environment for digital health. This basically talks about, are there legislation that helps the country that gives direction, that gives backing to the digital health solutions being provided? Are there policies, are there guidelines and things like that? So also at one extreme end of that spectrum for that, you have what we call the emerging enabling environment. And at the other end of the spectrum, you have the established enabling environment. So if you look at the graph that I have on the screen, you will find that Nigeria is in the upper left quadrant of that, of what appears to be that circle, which means that we're in a developing and building up environment. So if we push hard enough, we can get into the scale up and eventually the mainstream. If you think about it, Nigeria actually has a fairly growing ICT environment. Recently, we had 5G launch in the country. As we speak, we have over 200 million telephone lines to a population of just over 200. So there's ubiquitous availability of network coverage across the country. So the ICT environment is there. What we need is a regulation and the policies that will guide it. So this is important because where we are also speaks to the kind of policies that we're going to put up. And so if you look at the components of the policy the strategy that you will see in that document, you'll find along the lines of the 7 digital health components that WHO spelled out. You'll find things like leadership and governance, strategy and investment, legislation, policy and compliance, architecture standards and interoperability, capacity building, infrastructure, and things like solutions. The HealthXP app will fit into this kind of area. So the strategy spelled out some of the things that will be done with regards to these 7 key components of digital health. Now, that strategy document, as I said, led to the evolution of the National Digital Health Policy. And this was came into effect in 2021. Actually, I shouldn't say come into effect. I should say that this document was approved in 2021, but I cannot tell you with all sincerity that it is in effect right now. The document, though, it has been approved by government. I'm not sure it is operational as we speak. I don't think it's been published, so I don't know if it is operational. I can also tell you that in 2022, that was last year, I was part of multiple meetings where the annual operating plan was developed for this policy, but I don't know how much of that has been put into effect. But basically, you will see that this document, this digital health policy, takes its legal backings from a lot of other acts of government that exist, such as the National Health Act, the Health Records Officers Registrations Board of Nigeria's Act of 2004, the Nigerian Data Protection Regulation of 2019, the Cyber Crimes Prohibition and Prevention Act of 2015, and other similar acts of government that we can find around. Also very important is the National Nigeria Data Protection Regulation. And then another one is the 32 Nigeria Industrial Standards that the Society of Telemedicine led stakeholders to develop for the Standard Organization of Nigeria back in 2019. Those 32 standards have been approved and are in effect currently. So what is the policy thrust of the policy document that we're talking about? Basically, it's to address the application of digital health to strengthen national health systems capabilities to accelerate progress towards achieving universal health coverage. It articulates the government's commitment to providing an enabling environment for all aspects of digital health. So again, the policy document also goes along the 7 components of digital health that WHO spelled out, and you will find there the leadership and governance area, and then you see some of the policy statements that government has made. For leadership and governance, one key one is that government at all levels shall institutionalize a national digital health program. The Secretariat at the Federal Ministry of Health, responsible for overseeing digital health planning, implementation, coordination, monitoring, and evaluation to ensure achievement of the national digital health vision. So this is one of the statements, one of the key statements in the areas of governance for digital health. So one of the key policy statements that government is making. Now, for strategy and investment, I'm going to just read one of the key statements that we should be aware of, is that government at all levels, whether it is federal, state, local government, shall institutionalize innovative resource mobilization mechanisms for sustainable funding of national digital health programs through mobilization of funds that apply to health sector to incentivize digital health investment and encourage the private sector participation. So at the end of the day, government needs to create an environment where the private sector can drive digital health. Everybody knows that the private sector also is one of the key drivers of innovation, particularly in digital health. So we need to create an environment where the private sector can come in and then, be incentivized to drive it. So that policy is also, that policy statement addresses that. And then there's also the legislation, policy, and compliance. This is critical. It says the federal and state government shall ensure the provision of digital health legislation to safeguard digital health interventions, investments, and compliance to standards, thus mitigating economic losses and unwholesome health practices. Here, I'm going to say that, like this document that has a 5-year lifespan, policies are going to evolve because we are still in the growing stage of that digital health environment. We are still growing, so we're going to have to review our policies. And one key factor that must be taken into consideration when we review these policies is how we bring stakeholders together. So at this point, I'm going to say that HealthXP and other major stakeholders in digital health in Nigeria needs to practice and make known some of their findings through research, through committee of practices, where some of these findings can be shared and it can be passed to government to influence the policies that are made. Another one is architecture standards and interoperability. This is very critical because interoperability forms the basis by which we can share data, we can learn from what is being done, and we can connect all the stakeholders that are in the digital healthcare space. So it says the federal and state government shall promote development and ensure the use of digital health industry standards by relevant stakeholders across healthcare value chain. So up until now, everybody comes with whatever solution they think is good for what they are doing. A lot of attention has not been paid to standards and interoperability. But this policy statement states that we have to start paying attention to that. And ultimately, I know that the federal government is coming up with a health information exchange that will specify what standards and interoperability systems to ensure connectivity. All right, so capacity building just speaks to the need for us to start training human resource that understand what we do. For example, most of the solutions that we currently have in the country take their origin from health systems from around the world. Some of the solutions you have were developed in different healthcare systems, but the ones that are peculiar to Nigeria can only be understood by Nigerians who live in this system, who know how the system works. But to be able to get to the point where we are developing and are innovating with these systems, we must have a human resource system that understands what it takes to build this solution. So one of the components is that we must begin to inculcate digital health into universities and into all our training system. Another one is that there must be a career path created for digital health career. It says government at all levels shall generate a digital health career pathway with attractive remuneration and make digital health skills and knowledge competency a prerequisite for career progression to hold digital health managerial positions with government. So infrastructure is also critical, and there are a few policy statements in that regard, but for the sake of time, I'll just skip that. And then I'll go to solutions. Solutions shall ensure that government shall ensure that digital health interventions are developed and are used in a manner that promotes health data gathering, enhances care coordination and exchange of patient information, and improves health outcomes by addressing health system challenges. So solutions must be purpose-built and for meaningful use. And then every stakeholder they have roles and responsibilities that they play. And then in the policy for the private sector, some of the roles that they have to play includes that they shall contribute to digital health service delivery within the National Digital Health Policy Framework in compliance with national standards and guidelines. So national standards must be complied with. It helps to create an enabling environment that interoperates across board. And the private sector shall also invest in digital health infrastructure. Many people are already doing that, even though government has a lot of role to play in that regard as well. Then healthcare providers shall work with providers to ensure mutual accountability. I'm going to go into, so there's also a policy on research, because research is critical to the evolution of digital health in the country. But I'm going to go quickly into the Nigerian Data Protection Act of 2023. And this act was signed into law on the 12th of June 2023, barely 3 months ago. It provides a legal framework for the protection of personal information within territorial area of Nigeria. Establishes the Nigeria Data Protection Commission for the regulation of processing of personal information. So basically, the act, is just to strengthen. If you recall, in 2019 we had the Nigeria Data Protection Regulation 2019, and this act just builds on what we had then, and covers some of the gaps that was identified in that regulation, and actually also continues to give legal backings to everything that was talked about there. So it protects data subjects' rights and provides means of recourse and remedies in the event of the breach of the data subjects' rights. And also ensures that data controllers and data processors fulfill their obligations to data subjects. So basically, the Act also identifies what we call data controllers, also identifies data processors and the data subjects. Now, for everyone that operates within the territorial ground of Nigeria, there are requirements that are expected of them. And then for the private sector too, there are requirements that, they have to have what we call data protection compliance organizations if they meet a particular standard. And even if they don't meet, their requirements have for them that they have to have data protection officers in their organizations to ensure that they collect the public's data they are properly kept. So I'm going to stop at this point because I think I have overshot my time. I know that as we continue, there might be clarifications that are required, and I'll be able to provide those. Thank you very much.